Hi, Colorado Chiropractors. My name is Andrea LaRew, and I'm the Executive Director for the Colorado Chiropractic Association. And I am pleased to have Mike Beasley with 5280 Strategies join us today. He is our lobbyist and has been lobbying for more than 30 years and has been with the CCA as our lobbyist for 13, almost 14 years. And before we get into the legislative update and some of the things that Mike's going to share with us today, I do want to talk a little bit about why the CCA does what we do with our lobbyists. So, advocacy is one of the most important functions of this organization. We are the only organization for chiropractors in Colorado with a dedicated full-time staff and lobbyists who are constantly looking out for threats to your profession, ways to help improve patient access to care, protecting your practice act, and numerous other things. And Mike might get into some of that stuff. But I always try to make sure that people understand how important the advocacy efforts are. It's something that people don't think about until there's a crisis, but we rely on our membership dollars to be able to work with someone like Mike and have people in your corner 24 hours a day. So with that, I'll go ahead and turn it over to Mike. And we just, do you want to give us just a brief overview on the session? Or
Sure. And thank you. And it's an honor to be here. And let me start by saying that, a lot of folks question the need for a lobbyist. I don't care what group that I'm in. And a lot of times I'll ask people, raise your hand if you know a doctor or a chiropractor or a teacher or a policeman or a banker, any one of those groups. And I ask them to raise their hand. And usually after a couple of minutes, everyone in that room has raised their hand. And the reason I ask them that is because all of those different groups have representation in the Colorado legislature. And it's really important to have a strong voice. And in our case, we have a strong voice, but only as strong as our members help make it. And what I mean by that is belonging to an association that not only looks at legislation, but also the rulemaking that comes from that. And again, we're talking about state government. And what we saw during the COVID period is we not only worked 7 days a week for nearly a year during COVID with the state government, but we also worked with local governments as well to work through a maze of complicated public health orders. And so we are here to give chiropractors a voice. We are here to help patient access to chiropractors, and we are here to educate, mediate, and facilitate differences and policies between not only ourselves, but the other medical professions. And so that's what we did in this last session that just ended in the second week of May. It was a session where they introduced just over 750 bills, and they passed nearly 8 out of 10 of those bills. And while you wouldn't think, and understandably so, that there didn't always impact chiropractic care in terms of a chiropractor's actual interaction with the patient, but we worked on a variety of topics, things like workers' comp, things like taxation, income tax, sales tax, property tax that each of our chiropractors pay as small business owners. We worked very directly with other medical professionals. For example, we had a practice act that the physical therapists were running to renew their practice act for the next 10 or 11 years. We had some disagreements with the physical therapists on that particular bill that really would have affected the way some chiropractors market themselves or present themselves to their customers, to their patients. And so we had to work with them and legislators in both political parties, Republicans and Democrats, to get that bill in a way that didn't harm chiropractic care, chiropractors, or their interactions with their patients. And so that worked really well. I'll give you another example from this last session that had a direct effect, and that was whether or not a medical provider was an actual physician under Colorado law and requiring them, if they weren't a physician under Colorado law, that before, in our case, a chiropractor actually even touched a patient, they had to say, disclose to the patient, by the way, I am not a medical physician under Colorado law, and you need to know that before I touch you or before I treat you. And that was one of the really craziest ideas from this last session. We worked with a large coalition of lots of different providers, whether they were physicians or not under Colorado law, and with the bill sponsor to ultimately kill that bill. And those are the types of things that we do and have just finished in this last session.
Awesome. So what do you think are the kind of your thoughts on the overall political climate right now, and maybe as it specifically relates to healthcare and things that may impact the practices of our members?
One of the things that we are keenly focused on and has been a directive from our board of directors at the Colorado Chiropractic Association is in the healthcare space, this opioid crisis that not only Colorado, but the nation faces. And we're looking for ways that we can make the laws more and regulations more favorable for patient access to chiropractic care. And specifically, what I mean about that is trying to make the law and regulations more favorable to consumers who should want to come to a chiropractor before facing surgery, before looking at yet another prescription for some sort of opioid painkiller, and allow us the ability to treat that patient and that patient to see us if they choose to do so. So we work on things and have been successful in the past on things like insurance reform to make sure that co-payments and deductibles aren't an obstacle to patient access to chiropractic care. And I think we're going to continue to see that in a conversation in the 2025 session, for example. We work constantly with the medical society, acupuncturist society, association, physical therapist association, occupational therapist association, and many, many others in the healthcare space. Sometimes we work together to affect change, like insurance reform, either by carriers or by the commissioner of insurance. We work on gathering of data that policymakers have good data in terms of what our patient experiences are in a variety of treatment topics so that they make the best decision when setting policy in the legislature. And then sometimes, and I'm pleased to say it's not very common, but it does happen, there might be a medical professional that wants to do something that you do for your patients and or make sure that our chiropractor can provide that same service. So those each medical profession, as the chiropractors know, are all governed in a medical practice act of their own or their scope of practice. And sometimes those practice acts will cross cross lines in statute. And so sometimes we have differences of opinion on that, and we either have to work those differences out or we have to fight about it in the legislature. And so those tensions always exist. And it's one of the prime reasons why the Chiropractors Association should and does have a lobbyist in the Colorado legislature.
So, Mike, as you know, one of the top probably one or two calls that we get at the office weekly is questions about reimbursements, insurance reimbursements, and the rising cost of running a practice, the rising cost of living, and just a lot of frustration with that. So, what are your thoughts on that as it relates to public policy?
When I look back at our time with our team of lobbyists for the Chiropractor Association, and I look forward, this is one of those most constant issues. And there's always a tension between insurance carriers and medical providers regardless of who that provider is, whether it's a heart surgeon to a chiropractor. The frustrations are all very similar. They include things like reimbursement rates in terms of the actual rate that you're reimbursed for the services. Is that reimbursement, for example, less than the copay that you're collecting from the patient, as an example? It is things like the way an intermediary will help manage a patient's plan. And our intermediaries taking some of the value of that plan and putting it in their pocket as their fee to manage and to be the go-between between the carrier and the patient. We have worked for several years and have made some progress in changing the law and the regulations that affect this. But looking forward, there's always going to be that tension. Carriers are not the only ones that are reimbursing providers less, but when you look at state government, the federal government for Medicaid, Medicare, Children's Basic Health Plan, for example, all the state is being forced to either keep that funding level or to even reduce it. And you're going to see more of that tension, I would predict to you, over the next 2 or 3 years. It needs and will remain a top issue for the Chiropractor Association.
What do you think about the upcoming elections? Any thoughts about local or national and as it relates to healthcare and chiropractors?
One of the what probably one of the most important questions we could talk about today. One of the things for the members who are viewing this to know that the association does is we're very active year round, even in a non-election year, reaching out to legislators, reaching out to candidates for public office, and educating them on what a chiropractor does, what our policy priorities are, and what are the things that we want to do to help give patients more choice in the healthcare space and to really empower patients and you to do and provide the services that people required. Part of that process is, and our association has been very active, especially over the last several years, is we have a political action committee and we have a small donor committee. And we will interview candidates, not only to educate them, but to really see who supports chiropractic care, who will come to us and say, I want to help you in the legislature. I want to help on insurance reform. I want to get the medical family working together of all providers to do more for patients, to give patients choice. And so we do all of that. And why does it have to happen year round? Why can't it just happen in an election year? I get that question a lot as well. And the reason that is because, when you look at the election we're about to have, plus the one we just had in 2022, out of 100 legislators, we're going to have around 70 or so out of that 100 are going to be brand new. 70% turnover, maybe a little bit less, is a huge number, which means their learning curve looks like this. And so we are constantly having to reach out, educate, introduce ourselves, answer questions, connect legislators with chiropractors in their districts to be a local subject matter expert. Those are all the things that we do. So when I look to 2024, I see several things. I see a fight in the state house and the state senate over around a dozen or so seats because most of these seats are safe. So there are very few that are competitive. And so next Tuesday and here in June will be the primary election. And from there, we will go to the November election. And we're going to conduct interviews and meetings with candidates from every corner of the state and all the major political parties. And we will make endorsements in those races, people that we want you to know as chiropractors, or support your profession and really want to help. We're also going to let you know the ones who aren't very helpful and don't want to help. And unfortunately, there are some folks like that. And while we respect their views and their position, that doesn't mean that we need to support them. And it doesn't mean that we shouldn't tell chiropractors around the state who their champions are and who are not. And we'll be doing that right up until the election in November.
And I do want to share with those that are listening. One of the things that I think I appreciate most about Mike is it's exactly what he said. He is constantly uh, doing the outreach, thinking about who we should connect with, whether the session is in or not. And he's very good at setting up introductions and meetings and having those conversations, even without a board member or a staff here. He's always looking out for our association and chiropractors in the state, and has done a really good job of helping us build relationships with our elected officials. So I appreciate that, Mike. And
You bet.
so final question I think I have for you is, do you have any ideas about like what you think our top priorities should be for 2025?
I think as we go into the 2025 session, we're going to continue to have priorities that will include clarification of both legislation and potentially rules related to the types of um, treatments that chiropractors can give to make sure that the education and training they receive translates to their licensure. And we'll continue to work on that. That's an ongoing issue, but always one of the top and most important. We're going to have some conversations with physical therapists in 2025 to conclude some of the conversations we started in the 2024 session to see, are there policies that we can agree on in terms of how chiropractors treat, how chiropractors describe themselves to patients, and to really make sure that both practices act are clear and separate from each other, and that, can we work together to help people and not hurt our professions, both our professions. We're going to continue to do that. We're going to continue to see opioid conversations about, again, incentives to patients to get to providers like chiropractors. We're going to continue to see that as well. We're going to see workers' comp reform continue on in conversations around workers' comp reform. And that is just a beginning. Here we are in June of 2024, and we know we already have that full plate going into 25. And so that might be a good place to say, again, where I started, we have a strong voice in the legislature, but chiropractors can help us make it even stronger. They can not only belong to the association and empower us to do the legislation and the rulemaking, but they can volunteer to be on our legislative committee. They can make sure that they contribute to our political action committee. They can contribute to our small donor committee. They can volunteer to meet candidates in their own local district, put a sign in their yard for a endorsed candidate, that type of thing. And we're going to constantly organize and educate, facilitate conversation and learning. And that's one of the most valuable things about being a part of this association.
Great. Yeah, I was going to mention that too. If any of our members are interested in this work, we can always use some more committee members. We also need help with some of the outreach, and so contact me at the CCA office if you're interested in getting more involved. And then the political action committee, those dollars are all used to help promote pro chiropractic policy in the state. So we can certainly use your donations and contributions to that fund. The max is $725 a year, or every 2 year cycle. It just went up a little bit. So is that right, Mike? I think it's 725 now.
Yes.
So it's not like you can give 10,000. We would love $10,000, but you can't give that much anyway. So we have a lot of members who will just donate monthly over that 2 year span, and it works out to be about $50 a month. So it's really not a large commitment, but those dollars go a long way for us and the work that Mike does for us. Um, I think those were all the questions I have. Do you have anything else that you want to add
I
or
would
share?
say to any member watching this, there is no bad question. Any questions, they can reach out to you, and you can forward emails or phone calls to us. We're happy to talk about that. We're happy to go to any of our chiropractor meetings and talk about issues and to meet with people. And it's an honor to represent Colorado chiropractors. I know I love going to mine. And I want to we're committed to making the climate as best we can for patients and for chiropractors. And we appreciate your engagement.
All right. Well, thank you so much for your time and for your commitment to our association and our members. We really appreciate it.